Good afternoon, everyone. Thank you for joining us for the Healthy Transitions Colorado May 2015 webinar. My name is Kristen Paulson. I'm with the Center for Improving Value in Healthcare, and I'm very happy to be here with you today as we talk about the Pueblo Triple Aim Coalition with Matt Guy. Healthy Transitions Colorado is run by the operating partners, the Colorado Healthcare Association, Telegen, the Colorado Hospital Association, the Colorado Medical Society, and Colorado Rural Health. And it's managed by the Center for Improving Value in Healthcare. Healthy Transitions Colorado is a collaborative effort focused on aligning and accelerating existing efforts to improve transitions of care for Coloradans. Our guiding principle is that by breaking down the silos of healthcare, we can foster true community care coordination across facilities, specialties, and practices. HTC coordinates the tools, resources, and efforts of many partners across the state. We want to keep Coloradans healthy so they can enjoy more of what our beautiful state has to offer. These are our original 2015 campaign goals: to eliminate 8,700 readmissions across the state, reduce hospital stays by over 34,000 days, and to save $80 million for Colorado. I also want to mention that Healthy Transitions Colorado is putting on a learning series titled Cultivating the Network of Care. The learning series includes 3 symposia and a series of webinars that bracket the symposia and support networking and working with your community to really strengthen your care system. You can register on the Healthy Transitions website at www.healthytransitionscolorado.org and click on the Take Action Now button in the upper right-hand corner on our main page. If you haven't already done so, we'd also like to invite you to become one of our community partners and take the pledge to improve patient care transitions. To take the pledge and learn more about Healthy Transitions Colorado, again, visit our website. So a couple of things before we get started. The phone lines have been muted, and they're going to remain so throughout the webinar. We'll be using the chat feature available in the lower left-hand corner of your screen to field questions and allow you to make comments on the discussion. Questions that you make to the presenter will be answered during the question and answer session at the end of the presentation. The webinar is being recorded, and it will be posted to the Healthy Transitions website, so you can access this information again at any time without cost. So I'm now going to turn the program over to Matt Guy. Matt Guy is the Managing Director of the Pueblo Triple Aim Corporation and is responsible for overseeing all of the PTAC organizational operations, including reaching PTAC's goal to make Pueblo County the healthiest county in Colorado. Matt has also served as faculty for the Institute of Healthcare Improvements, teaching principles of implementing Triple Aim at the community level. Matt recently served as the Executive Director of the Southeastern Colorado Area Health Education Center and has also worked for the Colorado Rural Health Center. He consults with numerous local, state, and national organizations on community health and quality improvement programs. Thank you so much for being here, Matt. Go ahead and take it away.
Thank you. I appreciate that, and I appreciate the time to share the story of what we have done here in Pueblo with Pueblo Triple Aim's work, our structure, our data, and where we're headed here in the very near future. Many of you are friends on this webinar that know a little bit about the work that we have done and the work we continue to do, and I hope for those of you who don't know a little bit about what we're doing, hopefully you can apply it to the organizations and communities you're working with as well, as we go through today to review how we've decided with our population and our measures, how we've come to govern that and what kind of actions we're taking to move our community forward to make it the healthiest community in Colorado. And also to tell you how we got there and what kind of resources we've used, our governing structure, and to be transparent. I'll be honest about our successes, and I'll be honest about our failures too. So hopefully you won't reinvent the wheel. Hopefully you can reinvent the wheel if some of the things I tell you about have failed in our work. We really have 6 guiding principles with Pueblo Triple Aim. We really do have one solid purpose, and that is to make Pueblo County the healthiest county in Colorado. That core is what we believe in, what we are working for, and what all of our partners are working for as well. So having that defined purpose is very key to the success we've had, as well as defining our population. It seems fairly easy. We have a county of 161,000 people, but within that there are subpopulations that we have defined as well that we're going to be working with and continue to work with. So defining a population is very important. Along with portfolios, you can call them areas of focus, you can call them initiatives, whatever you want to call them. In the parlance of the triple aim, we call them portfolios. What are the actionable areas you're going to work on to make a difference with the health of a community? And if you don't measure all of this, if you don't have the data, if you're not precise about what's going on, there's going to be some questions. Will you be successful? Have you been successful? Well, what metrics are you using to prove that you've been successful? It's really key, especially when it comes to funding in the long term, that you be very precise about what you've done, how you measured it, and what successes and failures you've had through that measurement. And this is not a short-term problem. This is not a short-term process, and it's not a short-term solution. It is all of the above. You need to be able to do this for a long time, to communicate it pretty consistently across the board, and be very, very patient with this work. It is not something that's going to change in 18 months. It's not going to change in 3 years. It's going to take time. You can gradually do steps along the way. You want to show momentum, but you have to be patient with it. And you need to explain that to your governance and leadership, that they have to be willing to be into this for the long haul and not only support you in the short, but the long term, and to buy into the purpose and to buy into what the work is going to be doing. So for those of you who don't know a little bit about Pueblo, I like to point out that we've really got three great things going on down here. We have our Riverwalk. It's not San Antonio by any stretch of the imagination, but it's beautiful. We come and ask, would love to have you visit, especially during our Chili Festival in September or during the State Fair. We do have mountains down here too. We actually are a fairly diverse geographic community. We have an urban core, we have a suburban area in Pueblo West, we have our mountains, and we also have our farms on the Eastern Plains. And that we're a very proud community. We're proud of our veterans, we're proud of our local educational institutions, and for those of you who don't know, we have the best college football team in the state of Colorado, the Division II national champions at CSU Pueblo. So it's a very proud community, a historical community, 2 hours south of Denver, but that actually also creates some great opportunities and some great problems in that this is a community that was used to being influential in the state, second largest community in the state of Colorado for a number of years, and now is not even in the top 10 in terms of population. So there's a historical pride, but also some changes and some difficulties that we have faced because of that. And one of those things is our economy. And our economy has been in decline for a number of years. In the 1980s, our largest employer, which was the old CF&I steel mill, crashed. We had upwards of over 28% unemployment in the early 1980s, and really no backup plan. And the community is still recovering from that, and recovering from the fact this was an influential city, and it had a well-to-do, very active culture, had a well-to-do philanthropic movement, and those are gone now. And we're still dealing with that, and we're dealing with the ripples of that through our education system, where education is no longer as valued as it once was. So you put those things together on top of the fact that we are the unhealthiest urban county in Colorado, and it's not even close in many categories. If you go to County Health Rankings, countyhealthrankings.org, you can look at Colorado and look at Pueblo. We're in the bottom 10 counties in just about every category except for our availability and access to care in our community. So there's a bit of a dichotomy that goes along there. So when you put these things all together, it paints a pretty negative picture. However, and when you look at the data, you can just pile onto this, and you see that we spend a ton of money in this community on healthcare. We're at the bottom of most of the county health rankings, and we're really bad on health behaviors specifically. We're in the bottom 5 when it comes to health behaviors. We're well above the state average in our obesity and overweight. If you put those together, 2/3 of our population is either considered overweight or obese in Pueblo County, with a significant diabetes problem, with a significant smoking problem in this community, especially in our safety net. Our safety net population, at least 1/3 of our safety net population smokes currently. When you compare that to the state average of 17%, you see that we have a significant problem in that area, and that causes ripple effects within our health system and within our economy as well. We also have a significant teen pregnancy issue in our community. We've worked to address that, and I'll talk a little bit how we've addressed that. But to know that there's a lot of things that have kind of lumped on as we've gone forward. But people have looked at this and finally said, we need to make a change. this community is ready to move forward. We're tired of seeing all this data. We're tired of seeing all these numbers. How do we make a change in this community? Well, sometimes it helps if you have a push in the back a little bit. And that push in the back came in 3 different areas. One was in the cost of business. We have employers telling us we can't afford to provide health care for our employees. It's simply too expensive to provide that. And with a base economy of a lot of small businesses in Pueblo, our first and third largest employers are our 2 hospitals, our 2 community hospitals. So understand that the burden of health care is falling on a lot of small businesses in this community. And folks can't retain good employees when they're not able to offer that benefit, not only within our small businesses, but even our own healthcare systems have said it's really untenable. The cost of business, of being in healthcare, is too much now in our community because of how unhealthy the community is. And at the same time, we had some folks saying, we've got these new rules we've got to deal with. Our state health department and Senate Bill 194 requiring community health improvement plans over our public health departments, and the Affordable Care Act having nonprofit hospitals have to do community health needs assessments, really starting to take a look at, we've got to change this. There's got to be a way to change this in our community. And finally, we had a new payer come to our market in Kaiser Permanente, who also took a look at the metrics of the community and said, maybe there's something we need to do in Pueblo. Maybe there's a way we can start to push the community to be a healthier place. So there was different ways to look at this in terms of our hands on our back to say, it's time to change. It's time to really do something about this and to get the support behind a lot of folks in the community. So not just our hospitals who are trying to face the daunting task of changing healthcare and changing the healthcare system in our community and lowering the cost and making it affordable while still being the major employers in the community and being able to support our economy that way. And our safety net institutions saying we really do need help. We're a community that is significantly reliant on Medicare and Medicaid and transfer payments for a lot of what we do and a lot of our health care in this community. Public health has been on board since the beginning. Both our city county health department and our board of health has said, we're willing to do this. We're willing to look at health as an issue in the community, not just one-offs, not just some education programs, but we're really wanting to look at this holistically in the community. Having a payer at the table has been very vital for us, and they have pushed us to say, we need to change how things are done in Pueblo. And if we're going to come down and provide services and provide insurance in your community, we need to look at that. And it's not just in the physical health area. We have behavioral health at the table saying we need to be here. We need to be part of this. We need to look at integrated care. We need to look at coordination of care and how we do a better job as a community of linking all of our services together. But it's not just in it's not just in the healthcare community. It's really important to know that this is outside of health and healthcare, that part of the community is looking at us to say, this is an important issue. Whether it be our largest school district, which is Pueblo City Schools. Some of you may remember them as Pueblo District 60. And lots of the health improvements they've done and how to improve the lives of children through health, through the efforts in the schools. And businesses, our Latino Chamber of Commerce is a huge advocate for improving the health of the businesses of our community through the employees' health and how that improves the overall production in our community. And we've also had state support as well from Civic, who has been a big supporter of us, and other organizations throughout the state who've said, okay, we'll help you take this on. This is not a small task. This is not something that is just a one-off. You're going to need a lot of time and a lot of resources, but you can do this. And we know we can do this because we've done this before. We've been able to do single projects. So I talked about our Riverwalk and how proud we are of that, and it's true. And as a community, the community came together to put the Riverwalk in place, and it's a successful attraction, it's a successful business incubator for us. It's also the fact that we have the toughest smoking ordinance in the state of Colorado long before anybody else did. I think people mistakenly, even here in Colorado, think it was Boulder that did that. And as somebody who worked for the city of Boulder and actually worked with the folks who did enforcement of the smoking ordinances in Boulder, I know that was a much tougher ordinance we passed here than even Boulder had. And the state's smoking laws are based on Pueblo's ordinance. And we were able to prove that we could change the health of people in Pueblo by changing our smoking ordinances. We have an academic study that showed that we reduced heart attacks in Pueblo over the years since the smoking ordinance passed. So we know we can do this. And people laugh when I talk in health systems and health talks about Division II football champions. It's really important to know that that's a source of pride in the community, that the community did it itself. The community decided on its own that it wanted to have a football team back at our university. Our university gave it up in the 1980s due to budget cuts, and the community stepped up and said, you know what, as a source of civic pride, we want this. We want to be able to have student athletes, and the result has been Division II national champions, increased enrollment at our university, more athletes being able to enroll because we have more programs now, more students saying this is a viable place to go. People graduate. They are able to get jobs because of this. And we've done a lot of this because of a sense that we need to do this on our own. Not to say that having state supporters and others outside the community has been beneficial, but we understand that there's a geographical separation of Pueblo from Denver and the rest of the state, but also political separation, that the influence of the community is not there anymore. Where Pueblo was a major player at the policy level, it quite isn't anymore as it used to be. So sometimes these things have to happen independently and within your own community. Sometimes it's the best incubator, actually, is that you are south of Denver. You're not in Denver. People will ignore you a little bit. You can do your own things in your own way and be experimental and try different things. But this idea of having the ability to work together for the benefit of the community with limited resources coming in, and using the resources that are already coming in a different way to say, you know what, we need to look at health of the community as a whole, not just individual units. We need to be able to do that and change the way we look at the world. And we asked the question if we really wanted to do this. A lot of communities come together and say, yeah, we want to change health. And they write a nice vision statement or a nice mission statement, and that's the end of it. We've actually had significant meetings, and starting in October of 2010, those folks, those groups I talked about as part of the leadership, started meeting to say, do we actually want to try tackling improving the health of the entire community? Is this something we really want to do? And we had the fortunate ability to have some funding from Kaiser, to have the folks from the Institute for Healthcare Improvement come in and present this idea of triple aim in a community. Triple aim had been done in hospitals and healthcare settings, and it was just reaching out to now saying, well, what if we try to take the ideas of lowering the costs of care, improving the overall health of a population, and improving people's experience in health? What if we applied that not just at a health system level or a hospital level? What if we tried to do this at an entire community level? And we were fortunate to be able to do that and be part of that and have meetings around that to say, is this idea something we want to pursue? And we not only talked to that leadership, then we had a broader community meeting a year later to say, you know what, is this something the community is interested in doing? The leaders of the community, especially in the health world, but those others in education and business and state groups said, you know, this is a good idea. Should we do this? And I said, yeah, let's take this on. Let's be audacious. Let's try not just a one-off, but let's try moving the entire community. Of course, that came with a catch, which was, okay, we need a plan. We need you to come up with a way for us to accomplish this. And so that original group became a steering committee, and the steering committee wrote a strategic plan to say, okay, let's see if we can really do this. And understanding this was going to be something that was organic. It was going to change over time as we learned more and as we did more, that this strategic plan was going to be done in pencil. It had to be changed and alterable, but with some basic tenets that pretty much stayed the same. And what we decided really was to come up with this idea of a purpose statement, to say, why are we doing this? Why do we want to come forward? And to say that ever-rising healthcare spending weakens Pueblo's local economy, it threatens jobs, and has failed to deliver the improved health of Pueblo County citizens. And that this combination of increased costs and poor results threatens our community's future by diverting vital and limited resources from the investment in education and growth in our community. We decided that's what we were going to do. And it's a very powerful statement. It's a statement that indicts the community on its own. Nobody came in and said, you're doing bad. This is something the community is saying, you know what? Yeah, we got a problem, and we need to be able to fix that. And out of that purpose, the steering committee said, you know what? We need to form a coalition of folks, not just a few, but a bunch, that really can respond to that statement, to say, you know what? We need to fix this. We need to fix this problem. And so the steering committee said, yeah, let's take this on. And we decided that after some study, after hemming and hawing, really some difficult decisions in terms of where is this going to go? Do we need an organization? Can we just have just a steering committee that really has no formal authority? The decision was made that there needed to be a group in the community that had formal authority, that needed to be able to come into the community and say, you know what, health is a priority in our community. We're going to change this. We're going to work together to do this. So the decision was made as part of the strategic plan to create a new nonprofit, which is the Pueblo AAA Corporation. Its job really is to be the advocate for Pueblo, is a neutral convener. We have no bias, except to say we want Pueblo healthy. We are not pro or against any institution or pro or against any group working on making Pueblo a healthier place. We want to support everyone. We have a mix of health and non-healthcare members on our board, and that's really crucial because if this were just healthcare driven, many of the issues that are seen in other sectors of the community that relate to health and that surround health would not be paid attention to. We know that in healthcare, 20% of health is produced in the healthcare system and the other 80% happens outside the system. So having those non-health members on the board is very crucial, along with having leadership in the community on this board. Not to say there are great people in this community who could not serve on this board, but those folks really that can open doors, avail resources, and say to everyone else in the community, make time for this. Make sure this is important. While at the same time, keeping our steering committee around as the thinkers and doers. And I'll go more into how this layered structure really works. Because we really believe our structure as a coalition is not top-down, but it's a straight line across, with many loops back. So we have our corporation that gives us the high-level support. We have the steering committee, which is really a kind of our boots on the ground and our thinkers. But we then have ad hoc committees, where I talked about earlier, our portfolios, our areas of emphasis. These are the people that know what's going on the ground. And they're the ones that really can link back up to how is the community doing as a whole, and their individual efforts, those individual project efforts that group into our areas of focus and portfolios, then look at our broader community metrics to say, are we making a difference in our community? A little bit more specific about each layer of the coalition, our corporation, and I talked a little bit about our balanced board. One of the interesting things is the healthcare community, those leaders recruited the non-healthcare community and said, who do we want on our board that we need to have influence? So currently on our board we have folks from both of our hospitals. We have two hospitals in Pueblo. One is a community independent, one is owned by Centura. Our public health director sits on our board. Our CEO of our community health center sits on our board, as well as a defined seat for a payer, which is an unusual thing. That current seat is currently taken by Kaiser. But then we also have representation from CSU Pueblo. We have representation from our Latino Chamber of Commerce. We have representation from our United Way. And we had, until very recently, representation from our Economic Development Corporation. And we're looking to refill that seat with a CEO of a local business to give us that perspective as well. They are a critical level of support because they make this effort go. They're the face of the community to say, we're going to make health an issue, the issue in Pueblo. But at the same time, they're asking that question of how do we do this? And how do we do this as a corporation? How do we do this as a nonprofit? As a board, how do we push this forward? It's something that we're struggling with still, and something we wrestle with, is how does this board of a neutral convener make individual organizations more successful? We still work on that, but one cool thing the corporation has done is decided to hold each other accountable for the various portfolios that we are working on. And I'll go over what the portfolios are in a little bit, but to say there's some accountability that happens now at this level, but they're still working on what their real job is. The steering committee, which has now been around, actually it says 3.5 years here, but it's actually 4.5 years now, is very organic. It includes many of the folks that have started it, were at the very first meeting in October of 2010, but folks that we've also identified to say, the group itself has identified to say, we really kind of need their support at the table, whether that be now social services, whether that be other education entities, whether that be individuals in the community, but to really keep the organic nature of the the steering committee to say, we need a broader view for the community, and that's what this group does, is they look at the community as a whole. They look at the measures, they look at the data, they look at the portfolios to say, you know, is this right? Oh, is what we're doing right? Is this the best direction to go? Do we need to be working on other issues to make our community level measures work? And they not only review the community level measures, and the corporate board assigns the steering committee that idea. They are really the ones that sit and chew on all the data, and they sit and make recommendations about where things should be going. But they also have this ability to not only reach up to the board, but also reach down to the portfolios. Those are the folks that really can maneuver the system well, to maneuver the resources and maneuver the outcomes as well, and to make sure that everything is affecting the bigger picture and making sure we are doing the right thing for the community as a whole. And that's what the steering committee does. Our corporate board meets only 4 times a year. The steering committee meets on a monthly basis. So we've got the corporation, which does the high-level stuff, the steering committee, which really kind of is the meat and potatoes of the group. But then you've got to have the people that actually do the work. So we've got all these community measures, and it's great stuff. But how do you get stuff done? And the way you do that is you have to work on individual different categories. And these, what we call portfolio groups, are the ones that know what's going on. And they're critical to the direct work. And what's neat about this is we've taken groups that already exist in the community to move them forward. We have not created new groups within the community. We're really trying to make this truly an inclusive effort, not to say something brand new, we're going to reinvent the wheel. It's like people are already doing the work in the community. Let's talk to them. What are they seeing? What are their successes? What do they need help with? How do we make sure that what they're doing, that individual on the ground, whether it be tobacco education or changes in food systems or improving mentoring in our teen pregnancy or working with frail elders, that they have the resources, but then they also know that they're part of a bigger picture, that they are really the true movers and shakers of all of this. They're the ones that make things happen on an individual basis, and to make sure those programs are brought to the community so that they can affect the overall community measures. So those 3 groups, the corporation, the steering committee, and the portfolio groups, work across each other to make Pueblo healthier. To do this, you've got to have some foundational principles. And some of those principles I talked about earlier, but we really have pillars that underlie those principles to say, here's what we're really using to make things move forward. We use the concept of the triple aim. We work through collective impact. We have a modeling system called Rethink Health, and we really base everything on as much local data as we can get. How much data is there, and how much data shows what we're doing works, what needs to be changed. So for those of you who are unfamiliar with collective impact, I highly, highly recommend this. Collective impact really is our organizational effective strategy. That's how we really organize ourselves as a coalition, using a common agenda, which is very straightforward, based on our purpose statement and our mission, which is to make Pueblo County the healthiest county in Colorado. But we have a shared measurement system. We have a community database that the Pueblo Triple Aim Corporation uses, where we collect data and we look at it from a variety of different sources to say what's working, what's not working, what data do we have, what are we missing, but also to hold people accountable. And we are starting to do that. We're starting to hold people accountable for things that are happening, with the understanding that this is not everybody's daily job. And one of the reasons we created an independent entity is because other people have other things to do. And that we're not working in silos, but we want to make sure that we respect each other's special talents and abilities, so that not necessarily requesting one group to do something that's not out of it, that is completely out of its mission or realm. We do this by, we talk a lot. We send a lot of emails. A lot of folks get kind of tired of all of our emails, but we do. We send a lot of emails, a lot of folks. We're making sure that we understand everybody knows what triple aim is. You may not get it totally, but you understand this idea of, oh, we're trying to make people healthier and make it cheaper. Okay, good. Make sure everybody's happy with what they're doing. People get that and understand that. And collective impact really supports the idea of having a backbone support organization, which is what the Pueblo Triple Aim Corporation is all about. If you don't know what the triple aim is, and I've talked about it a lot, here it is in a nutshell, right here. How are we working on cost, how are we working on population health, and how are we working on experience? And we've changed experience of care in this and modified it slightly to say it's not just the experience of care, it's experience in health. because health is not just in the healthcare system. It needs to be community-wide. And what is that experience like? If you live in a unit, an apartment unit that doesn't allow smoking, that's great. But if you have one that does, that's a part of the experience of being healthy in a community. So you can see how that steps out just beyond our traditional boundaries. Pueblo is also very fortunate in the fact that we have a really cool tool called Rethink Health, which is a modeling system that looks at the long term of health in a community. It looks 25 years out, and you're able to, based on local data that we submitted to the Rethink Health folks, to say, okay, if we invest in these areas, what are the likely outcomes going to be? Are we going to have any savings? And can we collect that savings from improvements we've done in the system to reinvest back into the system to keep those improvements going? And it's a very important look out to say, not only to say, okay, we've got 3 years of grant money, what are we going to do in 3 years, but what are we going to do in 25 years? Can we change not just how many primary care providers we have in the community, but what if we improved care coordination? What would that do? What if we help people adhere to care plans? What would that do? What if we change the crime rate in the community? What would that do? What if we changed poverty in the community? What would that do? All of these get dumped into this system, this model, that you can look at and say, where do we want to invest our effort? And how much money do we want to have? Or how much money do we already have to invest in this? And what kind of outcomes do you get? And you see that you can change things. That blue line, these are just some basic examples to say, if we don't do anything, things will either stay the same or maybe get a little bit worse. But if we're able to do a combination of different things over a variety of years, we're able to lower our death rate. How much healthier are people going to be? How healthy is our safety net population going to be? Are we going to reduce that safety net population? Those are the kind of things you're going to be able to show through Rethink Health, and it really provides us the idea to say, okay, our community priorities have to be these things, these initiatives that will make the biggest change in the long term, and the portfolios we're working on need to match with those community priorities. And our 5 community priorities under Rethink Health are adherence support, creating pathways to healthier behaviors, care coordination, reducing avoidable ED use and readmissions, and reducing poverty. Those are the 5 things we found through the model that if we work on those, we can have an impact on that. And so our portfolios really have to match those, and those match up to the triple aim. Now, and I've talked a lot about what we're doing, but you have to be able to define your success and have data to define it. So we do that on 3 different measures. We have a missional way to do that. We have a triple aim, and within the triple aim metrics, and we have organizational success measures as well. And our mission successes really are based on the county health rankings. So if we want to be the healthiest county in Colorado, based on the county health rankings, might as well use the county health rankings to show where you're at. And right now, we're not doing great. We've got a ways to go. We not only look at health outcomes, of which morbidity and mortality, we're 52nd out of 60 ranked counties. We know there are more counties in Colorado, but a few of them cannot be ranked because of size. And where we want to go, and we've put some pretty audacious goals out there in the next 5 years to hit. Where do we want to move? We want to move up 6 counties, then we want to move ahead of an urban county. Same thing when we look at health behaviors. We want to move forward. Because these are really where the rubber starts to meet the road, where we talk about obesity, we talk about smoking, we talk about teen pregnancy. Those are actually measures covered in the county health rankings. So you can see where our on-the-ground work is linking with our mission. And we're 57th on that. We have ways to go, but we have people working on it. Most of our measures in the past county health rankings, even though our county health ranking did not move up, the individual measures have either stayed the same or improved, so we know we're headed in the right direction. We just need to accelerate our pace to make it work better. And it's not just data, hard data. You need those stories, too, that tell people that, you know what, we are talking about health, and it's more important, and that Pueblo Triple Aim has a value to the community, and that other communities are asking us for support, and that's how we know we're starting to move the mission forward beyond the data. In terms of the triple aim, and really focusing on those 3 areas of the triple aim, we've got measures for each leg of the triple aim, 2 specific measures for each. One is a traditional metric that's really public health related. So you'll see in this one we have years of potential life loss. We actually went down in that in the last go around. So we're very pleased with that. It's the first time in a number of years we've gone down in that, but we have a way to go to reach our goal in the next few years. But then we also have a less clinically related measure in each one of these. So this one is residents reporting fair or poor health. What are people say? It's not actually hard clinical data, but it's like, okay, what do people feel that's happening? And we have a ways to go on that. We're well above the Colorado average in these areas for population health. When we talk about experience, we've decided to not only use people without insurance as a good metric for that, but also this idea of clinical care. Who's accessing care? Who's using care? We have folks without insurance. We still have quite a few folks without insurance, but we do very, very well in the county health rankings in terms of who accesses care and the ability to access care in our community. So we understand one of the areas we are not focusing on currently is creating more access, because we already have it. We need to work on other issues to make this happen. So it's actually a nice success measure that we have to say we do have access and we continue to create good access. One of the areas, though, we need to really work on is our cost of care. And thanks to the folks at Civic, we're using their illness burden metric to say, you know what, we cost a lot more than the state because of how unhealthy we are. We may have great access, but we're using it a lot, and we cost a lot more. One thing we do good, and our hospitals have really been successful on, is been able to lower their preventable hospital stays, especially it relates to Medicare. We're almost to the state average on that. We'd actually like to be below the state average fairly soon. This is an area that our community has worked very hard on, especially our hospitals, and continues to be successful with. It's great to have these community metrics, but as an organization, you need to be able to show you've made some success, you've had some value added to your community. So we've got ways to do that. That includes an idea of where are we on the triple aim? And the folks at the Institute for Healthcare Improvement have created a scale for those who are training this on a community level. And we're almost, there's only 10 stages, we're almost to stage 5 already. So to say that we're almost ready to say we've made some progress, not only on our process measures, but maybe even an outcome measure, and I'll talk about where we might be on that, is to say maybe we're having some success as an organization, that we're also funded, and that we're staffed. And that's a key issue, to say we're stable, we have the money to continue to move on and to measure and to help our community move forward. It's also important to know that those folks who are our volunteers, those that are on our board and on our steering committee, are still there, and we constantly evaluate their support of the work we're doing to make sure it still aligns with their personal and their organizational wants and needs and desires. So that's something we continually work on and stretch out a little bit, and I think that's a suggestion that everyone should have, is that to make sure that we're not just here because we're here and we think we're doing good, but to make sure that everybody agrees with that and that the support is continuing on. So all of this to work to say, great, you're doing all this, but what's really actually going on the ground? What are you doing? So we have 4 very specific portfolio areas we're working on. And they surround obesity, teen and unintended pregnancy, smoking, and readmissions and emergency department use. And those areas have really specific goals. So we have our community goals, and you saw those measures earlier, what we're trying to do with the community, but how do you change the individual? And then this is how we're changing individual behavior and how we're changing our work. So these things we're working on together to change the obesity rate, to reduce it. And notice these are our short-term measures. These are really the things we're trying to do in the short term to say, okay, we are, in the next 2 to 3 years, what are we working on? And I'm going to highlight one specifically, and it's specific to Colorado, to say, this is one thing that we're really proud of in Pueblo, and the fact that we have reduced our teen pregnancy rate from 2009 to 2013 from 51 births per 1,000 teens to 37 is a huge success in our community. That alone has saved, just in the birth event, has saved Medicaid $1.6 million. So we know we have saved other organizations a lot of money and been able to use other resources to be able to change that. And that's been done not only through long-acting reversible contraceptives, but also through mentoring programs and positive youth development, so that we're be able to bring more than just the healthcare community in this. It's the business community, it's the faith community that all comes together as part of this. It's a big community effort, and we can plug in different community groups at this. Another example in our obesity portfolio is our Latino Chamber of Commerce is putting together a worksite wellness benefit as part of their membership package, where folks that there are businesses that want to help with their employees' health are going to get a benefit, especially related to obesity, and using Weight of the Nation as the way to kick that off. So we have different ways we're doing this. There's a question about, I see in here, as I talk about our different portfolios, there's a question about our Integrated Community Health Partners, RICO 4. Integrated Community Health Partners is a very big part of what we're doing, especially both in the smoking work and our readmissions and emergency department use. iChip is at the table helping us identify our safety net smoking population and working with them in terms of care coordination with our community health center and our family medicine residency and an internal medicine residency to work on programs so we can get on the ground free smoking cessation support classes for folks. So they're very key to that. And we're working with iChip on a specific project within the readmissions portfolio about frail elders. And there will be more to come about that. We're in the process of getting that ready to roll out, and we've got some cool things coming with iChip on that. So we're very directly involved with our RICO. And I've talked a little bit about our successes, not only within the portfolios, but on a broader level to say, you know what, we're stable. And we've got engaged leaders who've been involved to say, you know what, health is a community issue. We're willing to be a part of this. We're willing to put our names behind it, and we're willing to go forward. So that's important. I think if you don't have that stable long-term support from leadership, it's not going to be not going to happen. And that we now have health as a community issue. Both our city council and county commissioners are looking into this idea of health in all policies, where they're going to consider health every time they pass a new ordinance or a new regulation, that health is going to be considered as part of that. It's also nice to know that people are calling us and asking for our advice. We don't know everything, and quite frankly, we're sometimes a little scared the fact that we think we know what we're doing, but we've got a long way to go, and hopefully we can share the advice through this method and others as well, to really say, you can do this. People can do this. Hey, we can do it in Pueblo. Anybody can do this, quite honestly. And that this idea of teen pregnancy and the savings I talked about, and being able now to hopefully go to policymakers and say, we're saving money. You've done us what you've told us to do. Hey, time to give us a little money back to keep the ball rolling. So not just through legislative means, but also at the regulatory level to say, this is something we can do. At a policy level, we can start reinvesting in our own communities. When I talk about health in all policies, it's this idea that the support in the community is that no matter what's going on, especially at the local governmental level, that no matter what's going on, is this a zoning change, is it the way businesses are regulated, is it a new tax, whatever it is, that health be considered as part of that new ordinance. And that's something we have found that now is changing in terms of policy. So we think we can get other parts of our community to look at this, because health is such an important part of our community, and it's such an important part of our economy, that health needs to be considered when new policies and new regulations are being formulated. There are challenges to this, and quite honestly, we don't have as much of the business community as we would like at the table. We would like more education at the table. They come and go, and there are reasons for that in our community, which I will let you can find that out through the news media about why that is. But we would like more K through 12 consistent representation. They were on at the beginning, but we'd like them back again at the table in a more consistent way. We'd love to have both. We have a great payer at the table, and we have a great partner in iChip at the table. But we would really love to have more private insurers, and we'd love to have some representation from state Medicaid as well as part of our group. And we'd love to have the faith community involved. We have them in a very small way, but we think we can actually, with a significant and very vital and vibrant faith community in Pueblo, that they could become a very important catalyst for us to improve the health of the community. One of the things with this kind of work, you have to avoid the short-term mentality, and even my board still occasionally will look at things from a 6-month to 12-month perspective. And we have to remind them this is long haul. It's 25 years, and short term for us is sometimes 3 years. And quite frankly, to be honest, there's sometimes we just don't know what we don't know. There are places and things we'll walk into. We've occasionally walked into a brick wall or two and made some huge mistakes. And one of the nice things is that we have leadership that allows us to make mistakes and to learn from them and to move on. While finding that out, we still need to find the right places to plug in. While not knowing what we know, we still need some places that we know that we're not in the right places in every part of our community. That there are places we're missing, not just the ones I listed here, but I'm sure there are others. And plugging into the right people in the right places would really be important. We would be remiss if we didn't say that there's this idea now out there of fourth aim, or fourth part of the triple aim, which is this idea of it's not just population health, it's not just cost, it's not just experience, but there's this other piece, this what Dr. Berwick referred to about 1.5 years ago as an awakening on in health. There's got to be economic and spiritual and mental aspects that we don't consider right now, that we need to figure out a way to put in to the triple aim, and being able to add that, and being able to add who's not at the table to make a true difference for our community population, and making sure that the whole community is represented. So that's the end of my presentation. Here's my contact information, and a couple of you asked for that, so if you want to get involved or want to know more, here it is for you, and I'm free to answer any questions that folks might have along the way, or if you want to refute things that we're doing, that's fine too, or if you want to help us learn, we're willing to do that as well.
Thank you so much, Matt, for presenting. This is fantastic. I'm going to give everybody a couple minutes to get their questions together and get them into the chat box so we can continue the conversation here. But I've got a couple questions for you, if that's all right. With Healthy Transitions Colorado, we have at various times, gotten some stumbling blocks with various parts of the community. Can you talk about what some of your biggest community building and community activating challenges have been, and how maybe you've gotten over some of that resistance to change?
Resistance to change never goes away. It just rears its head in ugly other ways. We have had partners leave the table because they don't feel like they have been an important part of, or an important in their mind, part of the moving process. And one of the things we have done is always leave the door open. We've made sure that nobody's ever excluded. If they leave, they can come back. And I think that's an important thing that we can all learn when we're doing this type of work, is that you never shut the door behind you. And that sometimes it's not right for people to be at the table at the current time. And it's okay for not to invite everybody at the current time. So it's okay to say no. I think sometimes we get too big and we want everybody at the table. What happens is it gets too diverse and you spread out the work too much. And I think that's what happens when people see there's so many people at the table. They often will be resistant to joining. I think the other problem on the flip side of that is that this is a hard concept for people to get. This is a hard concept even for me to get, and I've been involved with it for 5 years now. And there's a lot of resistance to this because it's not short term. It doesn't really have an impact immediately on the work that folks are doing. And people can see this as a threat to their funding, especially organizationally. So you have to present this in a way to say, we're trying to promote everybody, the work that everybody is doing. Yeah, we're going to hold you accountable, but we also want you to be very successful and want you to provide you the right resources to do this. So that's where we've been able to kind of mesh them together. The one thing that we are working on now, is a new level for us, is this idea of impacting the actual individual on the ground. And we have great community partners that already do this, but now then, how do we work together to do that? And we're hopefully going to have a pilot this summer, my friends at Integrated Community Health Partners, along with St. Mary Corwin. We're looking at a neighborhood pilot project that Triple Aim will be a part of, to be really the measurement piece of, and to be one of the neutral conveners to impact a block and a neighborhood, and to really get that individual and meet them where they're at. And instead of asking, I think the great question is, instead of saying, what's the matter, going into those neighborhoods and saying, what matters to you? And that right there, I think, is the key way to get into it. What matters to you?
Great. Thank you. We've got a question from Jay Bedoin. Is alcohol abuse a significant public health problem in Pueblo? Less so than smoking?
Good question. We have significant substance abuse issues in this community, and I will add not just alcohol. It seems like Pueblo is the marijuana capital of Colorado some days, even though it's only legal in the county, not within the city. We have a significant heroin problem as well. So substance abuse is something that's on our radar, and is something we're actually going to be working on as part of our readmissions and emergency department use portfolio. It's not at the forefront yet, but it will be, because we know it's part of a much broader picture. So I would not just put alcohol, but it's actually substance abuse in total is an issue. But smoking is still a bigger issue in Pueblo than even that. So looking at those, smoking has the greatest impact when we look at all of our measures, if we're able to knock it down, and we have the most resources available right now to deal with that. I wish we had more substance abuse resources, quite honestly, and that's one of the reasons we're not tackling it right now.
Great. Another question from Cindy Willis. Do you have skilled nursing facilities on your Medicare readmissions project with iChip?
Cindy, a good question. That's actually a question to ask my friend Donna Mills, who is the CEO of iChip. She would know more about that than I will. I'm sure our skilled nursing facilities will be part of our overall portfolio, but I can't address that specifically with iChip. They will know more than I will at this point.
Great.
And like I said, we're pretty transparent. So if I don't know an answer, I don't know an answer. That's one I don't know an answer to.
So Claire Chadwell-Bell says that SNF admissions are part of the readmission project.
There you go, right there.
So there we go. Thank you.
And like I said, there's things we do, and part of our thing is sometimes we don't know what we don't know. And that's one of the things that's not directly in our radar, but is on somebody else's radar, and that's good to know.
So I've got another question for you. How significant was the public health funding for the long-term reversible contraceptives? How significant was that funding in the work that you guys were doing in Pueblo? And if that is not refunded, is that going to have a big impact on what you're working on for teen pregnancy?
It had to answer the first part, yes, it had a huge impact on our teen pregnancy rates. The availability of that through public health and through some school-based wellness centers was important. There's no doubt about that. That is an important piece of the data, and it shows. But secondarily, and yes, will it have an impact? I'm pretty sure it will have an impact on the data going forward. I don't know how much. I couldn't tell you. But the second thing that's important about what we've done with teen pregnancies is we're starting to create a culture where it's not acceptable for teenagers to have children. And that goes through our positive youth development, through our mentoring, and through the adults in the community having a positive impact on our youth. So it has to be both. It's not an and or. So I'm hoping that the loss of the funding for the long-term contraceptives will be blunted by a lot of the culture change work that has been going on in this community, and that by no stretch was that just the last 5 years. It's a 30-year process that we have been working on in this community, and I'm hoping that emphasis will show that we've changed the culture. Do we need more funding for long-term contraceptives? Absolutely, and I hope we can find it for not only Pueblo, but for the state as well. But I'm hoping that we've created a culture where now it's acceptable not to have teenage pregnancies anymore, and that through those other means that we're still able to keep that rate down. So, yes and.
That's really encouraging to hear. Thanks. Are there any more other questions from the participants? Not seeing any writing happening. So I guess we'll just wrap up. Thank you so much, Matt, for sharing the work that you've been doing down in Pueblo with us today. Thank you, everyone on the line, for joining us. Again, be sure to join us next month for the first webinar in the 8-month learning series. And then the learning series is going to bracket those 3 symposia that start in June, and they're really going to help you put community connection into action. So please visit the website and register for the events under the Take Action tab on the right-hand side. I hope this has been a great use of your time and that you're able to take the information that we've learned today from Matt and further your care transitions efforts in your own facility. The webinar has been recorded. It will be on the HTC website in the next day or so, and have a great day, everyone. Thank you.